Watching ProPix Canada Media and ProPix TV. I'm James Kuzno in the studio here in Metro Vancouver. At this point, the Australian Broadcasting Corporation, also the ABC, not to be confused with ABC Network of the US, is reporting on something that the CBC, the Canadian Broadcasting Corporation, and other news agencies have been reporting over the past several months. This has to do with medical marijuana being prescribed to individuals with schizophrenia, bipolar disorder, among other mental health conditions. Now, they're seeing a large increase in the number of people suffering from psychosis after being prescribed medical marijuana. One of the big concerns that they're having in Australia is that there are doctors and internet sites that allow for prescriptions to be given to individuals who may be at risk or on other medications dealing with these issues. They are not only issuing the prescriptions for the medical marijuana, but they're failing to notify or give professional courtesy of notification to the treating physicians and treating psychologists, psychiatrists, and others of these individuals. Now, it is becoming very clear that there are a lot of concerns when it comes to the individuals with these mental health illnesses being prescribed medical marijuana. Now, one of the things that I didn't see in certain reports was the impact of individuals who are utilizing medical marijuana in replacement of already prescribed medications, or the imbalance that comes from the interaction of both medications and the marijuana. So let's take a look at first the ABC report I'll bring up on the screen, and I'll show you what the concerns are when it comes to Australia. But it's also being echoed and mirrored in countries around the world, including Canada and the US, when it comes to psychosis level reports and increases in individuals suffering psychosis after utilizing medical marijuana. Now, of course, marijuana has been a staple in many people's lives for decades, not just recently as it came out to be legalized or to be allowed for medicinal purposes. So again, it's of concern to many medical practitioners in the level of psychosis that we're seeing. So let's take a look at the ABC report here. And this just came out. It was released on the 20th of July this year, so just yesterday in terms of timing. So let's take a look at what they said. The article here or report was by Janelle Miles and Elise Worthington. And again, they are with ABC News in Australia. So with this, they're warning of the significant increase of people ending up in hospital with psychosis after being prescribed marijuana. And their concerns come amid a proliferation of single-issue cannabis clinics setting up in Australia, some of them willing to prescribed via telehealth consultations with few checks. So again, they don't have the background and medical information of the patients to whom they are prescribing, and they are not consulting with the patient's treating physicians or other medical practitioners, which is seeming to be the biggest concern. With a continuity of care when it comes to medical, whether it's mental health or physical health, there is a real responsibility of communication to ensure the continuity of care is being followed. If you don't know the history or other medications that an individual may be prescribed, then of course you're not able to effectively balance out or to justify new prescriptions without knowing the potential interactions with others. Once again, as I stated at the top of the report, is that, of course, you also have the concern about people thinking that they can replace medical treatments or mental health treatments with marijuana completely, and therefore suffering the psychosis or other impacts of withdrawing from the other prescribed mental health medications. An example of this would be someone who is suffering from depression, who may be taking Effexor, venlafaxine, or other medications, there is an adjustment period. Now, this is important information for anyone suffering from mental health illnesses or other health illnesses. The example I'm utilizing is in relation to, as I said, depression. The venlafaxine or other medications take time to work their way into your system, and for your system to adjust to having them there and to create the proper balance or proper dosages. With that, of course, you go through periods where you may be nauseous, you may have more intense emotional adjustments and feelings, but after a few weeks of taking it and your body adjusts to it and your mind adjusts to this new balance, it does level off. If it doesn't after that period, then it would be important to speak with your prescription provider, so your doctor, your psychiatrist, or so forth, to make sure that you are getting the right medication. They may want to switch you at that point. Once again, when we look at this example, if you stop the medications cold turkey, instead of being lowered, having the dosages lowered, as you come off of the medications, that can create a real havoc with the brain, with the emotions, with the thought process, and other issues. You can feel nauseous, you can feel irritable, you can feel increased levels of suicide or injury risk, self-injury or injury to others. So it's important to really remember that you have to keep your doctor and your main treating doctor, whether that's your physician, your family doctor, your psychiatrist, you've got to keep them in the loop as to what you're doing. And that includes the introduction of marijuana, even if it is prescribed by another service provider or another healthcare professional. Now, with that, as I said, a lot of prescriptions are happening over the internet. Now, once again, this is a real concern because of the fact that they don't have the patient history and patient information. For people who are looking just to get the prescriptions, they may not be forthright with all of their medical history or with issues that they feel may impact getting what they want, and in this case, the prescription for marijuana. So these are things to look at, and there's more information coming out on this from countries around the world. As I said, the CBC here in Canada reported on it. NBC and others have reported on it south of the border in the US. So again, it is a real concern because it not only puts an additional drain of resources on the... Sorry, we lost our camera here, so let's fix that. So the concern is that it really does add to the strain, not only financially on the resources of the medical system and the healthcare system, but it also puts people at risk for higher levels of self-injury, self-harm, and of course, higher levels of potential violence or even psychosis of these individuals. So it's a very big concern that needs to be addressed. Now, with that said, I encourage you to take a look at the various articles and stories that are out there. I'm going to bring up on the screen a report that was done by the CBC, and that's Canada's Broadcasting Corporation. So this one here, again, was brought out a few months back. And this was done by Jonathan Orr, who is on CBC Radio. He is a very well-respected journalist and broadcaster. So he has brought this up in terms of the concerns. Now, Kulpreet Sharma, seen in this picture here, is a comedian, entrepreneur, and strategic advisor when it comes to cannabis and the Psychosis Project. This is an online resource created by the Schizophrenia Society of Canada, and he urges people to educate themselves as, once again, we were talking about increasingly potent cannabis products become commercially available in Canada. And again, this is also a concern if you are utilizing non-commercialized or non-prescribed cannabis as well. So if you do have issues surrounding mental health, whether it's bipolar disorder, whether it is schizophrenia, or anything else. And that includes physical ailments as well. You want to make sure that your doctor is in the loop as to what you are doing when it comes to self-medicating. And although you are getting a prescription from a telehealth provider, an internet consultation, and so forth. This is if you are not keeping your doctor in the loop or giving full disclosure to the prescribing physician on the phone or the telephone, or sorry, on the telephone or on the internet. Then again, you are essentially self-prescribing, and that can be very dangerous because there are interaction concerns of medications, and that includes marijuana. Even though most people see it as a completely harmless drug, it does have interactions with medication that can be prescribed, and that can, again, contribute further to the potential of psychosis. As I said, the biggest concern is not the financial strain on resources, the reduction of resources being available to others as they are tied up with people dealing with the psychosis. But most importantly, it's to make sure that people are not causing self-harm, not having harm outbursts and violent outbursts towards others, and that people can get the help they need and are being treated efficiently and effectively. So again, make sure that you are dealing with this in a responsible manner. If you know someone who is dealing with these different medical issues and they are not speaking with their doctor about it, I encourage you to have a conversation with them. And, it's going to be a difficult conversation potentially. It may cause some emotion or outburst from the individual to whom you are speaking, as they may get defensive and such. But at the end of the day, it's all about trying to make sure they are caring for themselves in the most proactive way while making sure that they are here tomorrow to enjoy the future that definitely can be very bright for individuals suffering from these conditions if, again, they are treated properly. So once again, I have just brought them up on screen, but I encourage you to take a look at the stories that are out there and the different research that's available, and just be aware that this is a definite concern out there. Once again, the CBC covers it and speaks about it not being your grandfather's weed. Again, the THC levels, the impactful contents of marijuana have definitely increased over the generations and over the decades. So it's a lot more potent and a lot more impactful on interacting with other medications as well as just your mental health in general. So I encourage you that if you are suffering from mental health or physical health issues and you're going to attempt to use, whether it is smoking marijuana, eating edibles, and so forth, that you definitely consult your physician before doing so, and make sure that that you consult your treating physician, not just any physician, because you want to make sure they have the proper history and your best interests at heart. With that, we just want to encourage you to be safe, to enjoy life, but also to make sure that your life is as long as it can be. Take care, everyone. Once again, this is James Kuzno with ProPix Canada Media and ProPix TV here in Metro Vancouver, British Columbia, Canada.